Good morning, everyone. I'm Dr. Chai-Min Lin from Taiwan. Today, I'm glad here to present you microautologous fat transplantation, MAFT.
The content contains 3 points of view. First, concept of microautologous fat transplantation. Second, what MAFT emphasizes and how it works. The third, the common error of fat grafting, microautologous fat transplantation, MAFT. MAFT stands for microautologous fat transplantation. In Chinese, 精微质体脂肪移植。We all know that fat grafting does not regain its blood circulation until 48 hours post-implantation. The reason is that initially, the inflow of the nutrients and the outflow of metabolites through cell membrane depends on the physiological phenomenon, direct diffusion, and plasmatic imbibition. Dr. Carpenter demonstrated that central area of the transplanted fat will be eventually necrosis and only marginal zone survival, approximately 40% at 1.5 plus minus 0.5 mm to the grafted margin. Moreover, he states that thickness and geometrical shape also play important role in fat survival. Therefore, no matter how the shape is, spherical or cylinder shape, the radius of the transplanted mass should be less than 2 mm to have higher survival rate. Only 40% tissue survival, 1.5 plus minus 0.5 mm to the margin edge, peripheral zone. He also emphasized that thickness and geometrical shape played an important role in fat survival. As literature mentioned, many complications after fat grafting, such as absorption, abscess, infection, cyst formation, fibrosis, calcification, ossification, and asymmetry, are related mostly to a largely implanted parcel. In this viewpoint, the phenomenon of central necrosis induces the cascade of a vicious chain reaction, leading to many unavoidable complications and unpredictable survival or retention rate of fat graft. Therefore, the fat graftlets are highly recommended to be implanted as small as possible by Dr. Fournier. In 2006, I myself proposed if the fat parcel is smaller enough, we might be able to decrease central necrosis as possible. Like this animation showed that the central necrosis will be decreased as possible if the radius of a spherical or cylinder is smaller enough. Based on the theory postulated by Dr. Carpenter and using the mathematical formula, each fed volume is calculated in this slide. The table showed the information of each fed volume at the radius of 1, 1.5, and 2 mm was 4.2, 14.1, and 33.5 mm cubic respectively. We conclude further that the injecting frequency of 1 milliliter fed grafting at the size of a spherical 1 mm in radius was calculated by 1000 divided by 4.2, yielding 240, and the spherical 2 mm in radius was 1000 divided by 33.5, yielding 30. Therefore, the injection frequency of each milliliter fed graft was better set between 30 to 240 to achieve higher survival rate by avoiding the formation of central necrosis. This animation showed the different trigger of fed parcel in 1 cc, 1/10, 1/30, 1/60, 1/90, 1/120, 1/150, 1/180, and 1/240 cc. This photo showed the different parcel volume in between of 1 milliliter, 1/10, 1/30, 1/60, 1/90, 1/120, 150, 180, and 1/240. Clearly, we could understand the real ratio of each fed parcel. Second point of view, what microautologous fed transplantation meant, emphasize, and how it works. This point of view composed several parts. First part, an innovative instrument to reflect the concept of microautologous fed transplantation. MOVAMIT kits, multiple orientations volume adjustable microinjection device kit, was a surgical combination set for fed transplantation or feeders injection with all purposes. The main portion MAFT-GUN provided an innovative operating system to deliver fed graft with a flexible volume of 1/60, 1/90, 1/120, 150, 180, and 1/240 milliliter per injection that meet the needs of the surgeons in performing fed grafting in different areas. Ease of use. Ergonomics in clinical application define the characteristics of the state-of-art device as a preferential assistance device in fed graft. This transmitting system of MAFT-GUN was patent designed under medical regulation to make the injecting volume as minimum at 1/240 milliliter per parcel by pulling the trigger as possible. With the micro-delivery mechanism, the radius of each injected droplet was possible made between 1 to 2 mm by pulling the trigger, which was essentially required and documented. Therefore, fat survival retention rate might be improved as possible when graft rate was transplanted in such small volumes from 1/60 to 1/240 mm, and there should be less potential central necrosis, which was the main reason of morbidities after fat graft. Second parts: precise, accurate, consistent, and miniature placement of fat parcel. Dr. Sidney Coleman has emphasized that each parcel must be between 1/30 to 1/50 ml per injection, especially in some locations such as periorbital area. As we know, there were many types of MAFT-GUNs clinically used for decades in fat graft. However, the minimal delivery volume per triggering is only reaching to 1/10 cc. Accurate but not miniature. Moreover, the underlying subcutaneous tissue of skin where the fat grafting is mostly placed have strong fibrous septum and top fascial ligament in between. Traditionally, while surgeons use the cannula to push tiny fat as wished, they often encountered the resistance from the tissue. Overexerting by hand with more strength than needed would happen. Therefore, a larger volume of fat parcel will be delivered unexpectedly and impossible to be aspirated out. The consistency and the miniature volume of each parcel, ranging from 1/60 to 1/240 ml, would be predetermined by switching the adjustable dial and constantly maintained by the trigger of MAFT-GUN. Therefore, during the whole operation procedure, surgeons could ensure an easy maneuver by such pattern designs, no matter how the strength used by surgeon. Third portion: avoid excess swelling and long downtime from other traditional modalities. Clinically, if surgeons want to transplant miniature fat parcels, a tunnel-like maneuver, to and fro, back and forth movements by moving the injection cannula was necessary in order to loosen the subcutaneous tissues and simultaneously place the tiny parcel as possible. With the utility of patent microcontrolling system in MAFT-GUN, a predetermined injecting volume of each parcel was secured by selecting the 6-grade adjustable dial and mandatorily controlled during the procedure. A steady, precise, and consistent volume was therefore transmitted by each pulling the trigger, regardless of the strength exerted by the surgeon or the speed of injection. Fourth part: alternative to overgrafting with manual massage done by many surgeons' maneuvers. As the animation shown here, two depression B and A will illustrate as soft tissue defects. Oftentimes, surgeons would over-inject two large parcels B and A, followed by vigorous massage to reshape. However, fat parcels tended to formate a confluence mass. Although the surface looks smooth and flat, the unavoidable central necrosis continued. Eventually, skin irregularity and uneven surface did occur as a morbidity. The parcel delivered by MAFT-GUN could be adjusted according to the virus area to graft and the different droplet size to select. Microstructure fat graft, therefore, was fully achieved by the concept of MAFT. Finally, MAFT with MAFT-GUN provided the high performance to surgeons. Traditionally, the surgeon had to turn the hand as often because the fixed pinhole of cannula has to be changed due to different grafting sites. The inconstant changing and the labor demanding of surgeons' hands always impedes efficacious performance. A clear marking with all-around adjustability of the instrument provided a precise control of injection direction. With these innovations, surgeons could change the pinhole of cannula freely, comfortably, and accurately. These multiple orientations design alleviate the laboring of surgeons and increase smoothness in performance. The user-friendly trigger system, by simple pulling maneuver, enabled the predetermined volume of each parcel to be precisely delivered. Moreover, right or left-handedness could be in advance preferable set in each handpiece and satisfiable to all surgeons. The MAFT-GUN itself is not only satisfied with fat graft, but also applicable to any soft tissue feeders. The same concept of microinjection transplantation, MIT, will do a good job for feeders injection. The last viewpoint is the 21st century is an age of the coming era of fat graft, meaning that it is also a new concept of microautologous fat transplantation, MAFT. Fat graft therefore plays an important role in more than a permanent feeder, as Dr. Sidney Coleman advocacy shows the promising future in plastic surgery and regenerative medicine. Therefore, the successfulness in completing a fat grafting would have promising applications not only in cosmetic but also in plastic and reconstructive surgery.
And thank you for your attention. And that's MAFT today and the MAFT-GUN for tomorrow, for the future.